afternoon. It's Thursday, July 30th, and this is your Health Scoop.
Think of it, gentlemen. Hoof and mouth disease, a thing of the past.
On last week's video, I managed to get a question that was about healthcare insurance, and the question was from a guy named Pumpkin Smasher. And you can go back and check the video if you want to see the whole question, but the gist of it was as follows. Why couldn't America ever adopt a free universal healthcare program like the UK, Canada, and France? Should we want that? A lot of different perspectives on this issue. So we'll start with why this idea is good. Honestly, it's very simple. Everyone gets healthcare. That's pretty simple. Everyone gets healthcare. Imagine this scenario, if you will. A guy doesn't have health insurance, and he comes down with, I don't know, vampirism. Now, assuming there's a cure or even a treatment for vampirism, which is undoubtedly very expensive, guy says to himself, well, I can't really go get treated for this. I guess I'm stuck being a vampire forever. But one of his friends says, hey, we live in America, where there is hypothetically universal and free health insurance. Why don't you just go down to the ER and get yourself checked out, man? Sweet! I guess I'll just go down and get it checked out. Free of charge. Thanks, America. What's better than that? The last thing America needs is vampires. The first question about whether this idea is bad or not is the fundamental ethics question of whether or not healthcare is a right or a privilege. Now, people who argue for universal healthcare, obviously they say that healthcare is a right, a human right. Any member of a civilized society has a right to the scientific medical advantage that civilization provide. That's not to say that that's always good, and then some people argue that it's a privilege. If you don't have a job, if you're not contributing to the society to which you belong, then you shouldn't have health insurance. If you don't have health insurance, go out and get a job, bum. I don't know if you're a bum or not. I mean, I don't work for my own health insurance. So obviously I would disagree with that point. Whatever. The next question that I would point out as to why this idea might be detracting from the American health as a whole is who pays for all this. Now, obviously, since the government is paying for it, then you're paying for it. As a taxpayer, you might be paying for someone who doesn't have health insurance otherwise, and your taxes will probably go up. A lot of people don't like that idea. In fact, most people don't like that idea. Americans are pretty materialistic, like to hang on to their money and spend it the way they want. Sorry, someone at the door. Anyway, what was I saying? Oh yeah, who pays? I'm not here to say if they're right or wrong, I'm just saying that that's the fact. And the last idea of why this might be a bad idea is the wait. We've already seen universal free healthcare in action in Canada, the UK, and France. And there are a lot of horror stories about this kind of thing. I remember one story I read on the internet in the news in London of people waiting to get into the emergency room in stretchers in the streets, which is really not a conducive treatment environment. You might have guessed that yourself. People waiting for surgery that can save their lives. When you have universal free healthcare, people are going to take advantage of that. Take, for example, a guy who got a paper cut and wants to make sure that it was taken care of properly, next to a guy who got his hand caught in a cement grinder and probably needs stitches right away. Those are the basic ins and outs, as far as I can tell, about universal and free healthcare. I'm considering making this a two-parter. I have a lot of people asking me questions right now about what Obama's planning to do with the American healthcare system and where that reform is going. In my honest opinion, I don't think Obama knows how it works. That's not a slam against Obama. I just think that most politicians don't know how this stuff works. I barely know how it works myself. So maybe next week, if I don't have any questions or anything like that, I can go over that, try to dig up as much as I can about it. I'll see what I can dig up for you guys, and hopefully I'll have a video about that next week. So I'll see you then.
That's very funny to me. Y'all ain't laughing though.